I would like to share with you today something very dear to my heart, which is sports injury. Because I was injured doing sports in my life, and since I enjoy practicing or participating in different sports, I had a back injury, low back injury, way back when, about 20 years ago. I had back surgery and it was very successful, and I was lucky. After that, I was able to resume my favorite sports like running, cycling, even downhill skiing. I enjoyed every bit of it until about 2 or 3 years ago. Then I had crippling pain down both legs, mostly on the right side. I had surgery then to repair the problem. However, it left me with devastating, painful condition, worse off than when I started. A year and a half later, I submitted to another surgery, and they did spinal fusion on my lower back. Nonetheless, I continued on to have pain, leg twitches, involuntary leg movement, and what you call restless leg syndrome. That totally deprives me from my ability to do sports and regain active life the way I like it. So I asked one of my colleagues to do stem cells, autologous stem cells. He actually harvests the fat from my little bit of fat I have, and that improved me by leaps and bounds. Now I'm back to running, despite the fact I know better than not to run, but I enjoy running, and I'm swimming, and I'm going to prepare myself for the ski season coming this winter. I am passionate about taking care of patients with back pain. In the past, we used to use epidural injection, and we used to use steroids or Depomedrol. I have changed this practice, and I started using PRP, platelet-rich plasma, enhanced platelet-rich plasma, and I injected in the epidural space. I just finished a procedure just a few minutes ago, and this patient is a post-surgical. He had 2 surgical procedures, and it did not correct him whatsoever. And I am attempting to actually rub the pain away from him. In other words, correct his painful condition and rehabilitate him, get him back again on his feet. Because when you have low back pain, it deprives you not only from your mobility, but actually it cramps your style and puts you in a sad mode anyway, and your mood become so clouded of that fatigue, muscle pain, irritability, etc. So I'm quite conscious about these issues, and I'd like to help patients that have suffered low back pain. Thank you for listening.